I had the opportunity to work with several different Department of Surgery faculty members on a few different projects. One of my projects was focused out of the Palo Alto VA, working with Dr. Eisenberg and Dr. Liebert. And that was a clinical project looking at the effects of a multidisciplinary surgery clinic on getting patients who were coming for bariatric surgery up to date on their preventive health screening tests. Additionally, I worked with Dr. Gallo and Dr. Bonham from the Division of Abdominal Transplant, working on clinical projects using a national transplant database to look at different types of outcomes in pediatric liver transplantation and how utilization of certain types of liver grafts and transplant center volume affect outcomes for pediatric liver transplant recipients. I've had an interest in transplant surgery since medical school, and I actually was a medical student here at Stanford. Had an opportunity to work with Dr. Gallo throughout my medical school time, and really enjoyed my experience with her, and had an opportunity to continue that type of research during PD time. And I knew it was a mentor-mentee relationship that worked, and it was a topic that I was interested in. The project from the VA was a little more unexpected, but I've known Dr. Liebert since she was a resident here, and have worked with Dr. Eisenberg on my clinical rotations at the VA, and I knew that the combination of mentorship I would receive for this particular project would be exceptional. And I have not been disappointed. So it's been a unique combination of working on projects in different fields, but I find both of them interesting, and I think they will, both in different ways, affect my decision making as I move forward in residency. Additionally, I participated in a research fellowship program through the Chan Zuckerberg Biohub up in San Francisco. And this was a great opportunity to combine my research experience with a longitudinal curriculum for physician scientists who are interested in an academic career once they finish their training. So I was one of the I was actually one of the initial people in the first cohort, and so it was a great experience to have like-minded trainees, not even just in surgery but other fields, who are also interested in pursuing academic careers, and the curriculum that was designed was so applicable to what my goals are with regards to pursuing a career in academic surgery, and I learned quite a bit from those sessions and just from networking with the other people in my program as well. We haven't gotten our electives yet, but I'm hoping to do an elective in transplant surgery. I've always been a person that bases my life decisions off of my personal experiences, and I think one of the things I'm really looking forward to about coming back as a PGY3 is to have additional experiences on rotations as a more advanced resident, as opposed to being an intern, where the experience I anticipate will be somewhat different and more informative to my ultimate decision of what field I want to go into.